to the Winterhaven Chamber of Commerce Ask the Doctor series. This series is done in partnership with Baycare's Winterhaven Hospital to make sure you, the community, have an opportunity to get to know our local physicians, as well as the services that Winterhaven Hospital provides to keep Winterhaven healthy and thriving. On today's episode, I have the pleasure of speaking with Dr. Ashley Lopez, who is an obstetrician gynecologist here in Winterhaven. Dr. Lopez tells me a little bit more about her journey from Ohio to Florida, as well as her tips on preventative care for her patients and much more. Well, Dr. Lopez, thank you so much for being on the show today.
Oh, wow. Thank you so much for having me. I'm so happy to be here.
Yeah, we are so excited to have you and be able to talk a little bit more about you and what you do here in Winterhaven. Before we get into the meat of the conversation, I'd love to hear a little bit about you, where you're from, your educational background. So share whatever you'd like to share about yourself.
Absolutely. So I am actually born and raised in Youngstown, Ohio. So
Oh, really? I'm from Ohio.
Where?
At Columbus, actually.
Okay. I have family in Columbus. They will never
Nice.
leave Columbus. I don't think they love it so much.
Oh, I love that.
Yes. But I'm from Youngstown, so northeastern Ohio.
Yep.
Grew up there during high school. My parents actually got a job out in Arizona. And so we were going to make a shift, but my sister and I ended up staying in Ohio, actually, finishing up school there. And then once I finished up in high school, I went to undergrad at Youngstown State University. So I stayed local.
Okay.
And then I went off to medical school at Ross University, which is one of the Caribbean schools. And I think a lot of people are like, wow, you went to the Caribbean. And it was a very poor country, but it was nice. You do all of your book work there, and it was a way just to kind of have no distraction. It was awesome.
Right.
And what was nice was my sister started a semester before me, so I had family there. So
nice. That
great.
Worked out well then.
It worked out super well. So you do your book work on the island, and then once you're done with that initial part of the medical school training, then you go and we move back to the United States, and that's where we do our clinical rotations.
Okay.
So I spent a lot of time doing most of my clinicals in Michigan. I did a few.
That's really interesting because you're from Ohio.
No, when I first moved there, they're like, where are you from? Ohio. They're like, don't tell anybody that.
Right. Keep that to yourself. But that's funny. That's really funny.
Don't tell people. So ended up doing quite a few clinical rotations in Michigan. And then I moved to Baltimore for a short period of time. And I did a few rotations in Ohio back in my hometown in Youngstown.
Okay.
And then I got accepted into a residency program back in Michigan. So where I did a lot of my clinical training is where I went back for a residency, which was really nice because I knew the program, I knew the residents there, I knew the attendings there, I knew the hospital system, which was nice. It made the transition a lot easier for me.
Right. And then how did you make it to Winterhaven, Florida?
Yeah, that's a very good question. So actually in residency, I started loving ultrasound and high risk obstetrics. And so part of me wanted to go the route of doing a fellowship in high risk obstetrics. So that would be maternal fetal medicine. And I ended up getting an opportunity down in Detroit at the NIH, the perinatology research branch, where I took a year after residency. I did not do any kind of clinical work, and I did a research fellowship with them, and I was trained in ultrasound. So I had the opportunity to work with these experts in ultrasound and fetal diagnosis from all over the world.
Wow.
And then after that, things kind of shifted in life, and I decided to take more of the generalist route. And I always knew I wanted to locate more in the South or relocate more in the South. And Florida was an awesome place. We have some family down in South Florida.
Oh, nice.
Yeah. And then just looking for opportunities, there was a very large need of OBGYNs in the area. A lot either retired or moved. And so they needed docs in town. So it opened up so many doors, and I actually met Dr. Jake Booker, who is my partner now, and I couldn't be more happy to be part of his practice and have him as my mentor.
That's amazing. And it sounds like you have had an amazing wealth of experience in a lot of different areas as
Yeah.
far as like where your physical location is. You've been able to kind of travel around and get a feel for different areas. So, what has it been like, you know, being a part of medicine in places like Ohio and Michigan and Arizona, as opposed to Winter Haven? What would you say is something that has stood out to you about practicing medicine in Winter Haven specifically?
I like the small town feel here. Obviously, when you're in training, you're part of it's usually a larger hospital system, and
Right.
it's big.
Mhm.
And sometimes I think when patients come in, they almost feel like they're just a number and not really treated
Mm.
as an individual person. And I don't see that here in the community. And that's why I love the small town feel of Winter Haven. The hospital and how they treat our patients is just wonderful.
Yeah, there's something special about that. The small town hospitality vibe that you get, and it makes you feel kind of part of the community. So that's
Mhm.
awesome. So how long have you been practicing in Winter Haven?
So I moved here in the summer of 2020, was working on all of the paperwork and trying to get credentialed, and I didn't
Mhm.
start working until about November of 2020.
Okay, wow, wow.
So relatively new.
Yeah. So as far as you being new, like is there anything that you are like, this is my favorite thing about like living in Winter Haven? Is there anything like that that you'd want to share?
So everybody that I talk to is talking about the growth here, and I hear it all the time. And I've actually seen quite a bit of growth since I've been here, just since 2020, which
Right.
is fantastic. I live in the downtown area, so I have
Oh,
access to the farmers market to be able to walk to places like that and all the different
yeah.
restaurants that are popping up here and there. And then just the central location of Winter Haven in general. So you get this really small town feel, but you have access to everything that you absolutely need here. And then you're in close proximity to going to Orlando or going to Tampa
Right.
without
Well,
the.
I would venture to say you're living the Winter Haven dream right now,
I
being able to live
know.
in downtown and you're able to kind of get the best of both worlds. So that's really awesome.
Mhm. Yes.
So why don't you tell us a little bit about your role at Winter Haven Hospital, your role in the community, and things like that?
Sure, absolutely. So I am part of a private practice in town. Our practice is Winter Haven OBGYN. We're over on Central Avenue, and that's where we run our office. But then we also service the hospital. So for Winter Haven Hospital as well as Winter Haven Women's Hospital. And
Okay.
so all of our deliveries are at the Women's Hospital, and then all of our gynecologic care is over at the main hospital if we're doing surgery.
Mhm. So what does your day to day look like? Because obviously obstetricians is it's a lot. It's a big umbrella of different things. So what does your day to day look like? Is it different every single day?
It is, and I think you have to have your roller skates on.
I bet.
Things are very unpredictable, and I think that's what's exciting about the field is you never know what you're going to get. So you need to be very adaptable, and I think with having the opportunity to move around so much, I mean, you have to be adaptable to be able to
Right.
do that.
Right.
But day to day, I would say we have office hours that are set office hours. Every other Monday, we are heading over to a surgery center in town to perform some outpatient procedures that are just minor cases that the patient comes in the same one day, leaves the same day. We have a set surgery block over at the main hospital, and that's performing more of the higher acuity cases or more of the bigger cases. If we're doing a hysterectomy, for instance, or a robotic hysterectomy, we have all of the access to the technology that we need at the main hospital. But every day you could find us in the office setting and then kind of running back and forth between the two hospitals, running a lot over to the women's hospital if we have somebody in labor.
Wow. So you really should be on roller skates.
We should be on
Absolutely.
roller skates. We
Yeah.
should.
I love that. Well, so, there's obviously, like we said, and like you said, there's a lot that goes into your specific area of practice. So, what are maybe some of the common symptoms or issues that people would have that they would come see you specifically?
Absolutely. So I would say there's a pretty wide spectrum. We see patients who are coming in just as routine preventative care. And so that is a well woman annual visit. We like to see everybody at least once a year just to make sure that we're maintaining health. We're touching base with any kind of medical conditions, trying to prevent anything from happening. And then also touching base and reviewing what medications you're on. Is there anything that we can offer you? Do you have any issues? But then on the flip side of that, we also have patients who come in with, let's say, a problem visit. So that could be anything from, I think my bleeding is abnormal, or I'm having some strange discharge, or I want to talk to you about birth control. What are my options? And so it varies daily, and we see all of these patients coming in. We flip from an annual to a problem visit multiple times throughout the day.
So you really have to stay on your toes for that.
We have to stay on our toes. Yes.
What would you say that some of the common treatments are? And again, you have such a broad variety of people coming in, but is there certain treatment options that you see that you guys are utilizing more often than others?
Absolutely. So I would say we, in the office, what is nice is that we have an on-site lab. So anybody who's coming in, if we need to do lab work for their convenience, we're able to draw their blood in the office.
Oh, nice.
We also have an ultrasound in the office and a wonderful sonographer. And we're able to, as providers, go in and watch the scan being done live in case we need additional images or if we have questions about certain things, which is much nicer than sometimes getting a report from an outlying facility where you can't actually see a live image or ask for additional images once it's already finished. So those are a couple things, but as far as procedures or treatment options, so if we talk about just breaking down some of the most common issues, if we talk about, let's say, birth control. So some of the birth control options that we do might involve a procedure, whether that's inserting an IUD into the uterus, which is a long-acting form of birth control that is just as effective as getting your tubes tied. It's a very nice option, and it can be good for anywhere between 3 and 7 years, depending on what device we're using. So we're able to insert those in the office. We're able to also remove those in the office. Moving forward, if someone were to have problems with incontinence or problems with prolapse, where they're feeling bulges in the vagina and some laxity in the tissues, then we may offer a pessary that can be placed. It's a little device that can go into the vagina to help add support. We also offer some procedures in the office where we can evaluate the inside lining of the uterus. So if we have concerns with an ultrasound where the inside lining of the uterus might look thickened, then we may want to get more information, whether that be a biopsy of the inside lining of the uterus, or if we want to actually take a scope, which is called a hysteroscopy, where we take a scope, we put it through the cervix into the actual inside lining of the uterus, and we can distend it with some fluid and take a look. And so we're able to tell you right then and there if you have something that looks abnormal. On the flip side, instead of doing that with an actual scope, we can also take you into the ultrasound room and we can put fluid into your uterus and scan you at the same time. And when we open up or distend the inside lining of the uterus, then we can actually see if there's any kind of pathology, whether there's an abnormal growth at all. And you can get answers right then and there. So it's more so diagnostic. And then we talk to you about your plan if we need to take you to surgery. And then at that point, we would take you over to our hospital with Baycare.
Well, that's really amazing to be able to have all of those things at your fingertips. I mean, you mentioned a variety of different things that you can do right in your office. That's amazing. Do a lot of patients come to you for that reason because you guys have access to that right then and there?
And I think even if they're not coming to us for that, I think once they find out, they are so happy with the convenience. Oh, I don't have to go to the lab down the road. I don't have to wait in their waiting room. I don't need to go and get my ultrasound done somewhere else and then wait for the results to come back.
Right.
So I think having everything inside our office is, number one, convenient. And I think it offers better care for our patients because the quality of our studies are,
Yeah.
I guess, much more improved.
Yeah. And I mean, quality and convenience are huge. I
It
mean, people
is.
want quality care and then they
They
also
do.
want the convenience as well. So that's really cool.
And I think one big thing that I haven't mentioned is that we see a lot of pregnant women. So we offer prenatal care. And I know before I was talking a lot about some gynecologic issues, but we also do the obstetrics portion. And so within the office, we have myself, Dr. Booker, who's in charge. And then we also have a couple other providers in the office. So we have a certified nurse midwife. We also have a nurse practitioner, and we recently hired a new physician assistant. So we're growing and
Yeah.
growing, but between us, we have 3 providers in the office who are offering prenatal care that we can see you throughout. And then we also deliver over at the Winterhaven Women's Hospital.
Oh, that's cool.
So it's nice for the women to come in and be able to have their ultrasounds in the office. If we need to do any kind of antenatal testing or testing of the baby during the pregnancy, where we put you on the monitor and listen to the heart rate, or if we do an ultrasound looking at different parameters to tell how well the baby is doing, we can do that all in the office without sending the mom out.
Wow. And that's huge too, because I'm sure pregnant mamas don't want to be going all the way to different places and all that.
No, exactly.
So one thing that you were talking about before was preventative care. You know, you guys obviously want to get ahead of certain things. Are there any tips that you would give to maybe any women listening about how they can, you know, kind of like be in tandem with you guys on preventative care, like how to take care of themselves to avoid maybe some issues that you guys see in the office?
Absolutely. I think diet and exercise are extremely important. And funny that your overall weight can impact how your menstrual cycle is. There's a lot
Mm,
of, and then also your cardiovascular health. There's a lot of impacts, but I don't know if everyone realizes how much of an impact it can have on your fertility or your menstrual cycle. So I think that's really important. And I think knowing your body, knowing what is normal for you, if you notice anything that seems abnormal or something new, let us know. Don't
mm.
wait on it. Don't worry about it at home when you can easily come in and we can tell you either it's normal or we can get the ball moving to figure out what it is and how we can help.
Right.
um, it breaks my heart when I see people come in and they either don't know anything about their history or they've been told that they have certain medical conditions in the past, but they have no idea what that medical condition is
Mm,
or how they've been diagnosed with it. It's the lack of education. And I think that's what I see a lot in our office is taking the time to educate the patient. At the end of the day, if someone comes in to see me, I want them and my visit is successful if you can leave knowing what I thought was wrong, what are your options, and if you can describe what I'm telling you in your own words so
mm.
that you can pass that information on in case you move somewhere else or if someone else asks you and it's pertinent. But it breaks my heart when people come in and they have no idea because they're either afraid to ask or people talk above them in words that they don't understand,
Mhm.
and it's not fair to the patient.
Right. That, and there's a benefit for sure of being able to walk into a doctor's office and feel comfortable. And obviously, there's probably a lot of doctor jargon that you can get really confused
Yes,
about. And if people aren't comfortable asking, then it's a little bit confusing. Like, well, what is the state of my health right now? So it's
exactly.
good to, you know, try to make sure that people are comfortable when they come to see you to be able to be like, well, is this normal? What do I need to do? And being able to lay out the options for how they can move
Exactly.
forward. So that's
Exactly.
really
And
important.
I think some people forget and some people seek care when there's only a problem. And we want to
Mm,
see when there's not a problem so that we
right.
can prevent problems from happening.
Yeah.
So
Yeah.
if you think you're okay, but you haven't been seen for a while, we recommend you coming in so that you're seen routinely.
Right. Right. So if there is someone who is watching or listening and they're like, you know what, I probably need to go see Dr. Lopez, where can they find information? How can they make an appointment?
Absolutely. So we're trying to make this easier, and we keep brainstorming ideas, but you can either call our office. So we can put a link on here, but our phone number is 863-299-1107. We are Winterhaven OBGYN. We're located on Central Avenue. You can pop in and ask for an appointment. You can call our office and ask. You can go onto our website. There's a lot of information about our providers in the office, what service we provide. And then there's also some educational links as well on the website.
Oh, sweet.
On the website at the bottom, you'll see a widget, and you can actually contact the office through a little chat instant messaging system, and you'll get an instant response or a response within 24 to 48 hours. And then if you are already an established patient in the office, if you have any concerns, you can either call the office or you can put a portal message through, and we will get back through you through your portal.
Wow. So there are quite a few options then.
There are quite a few. We're trying to make it as easy as possible. So
that's good. Hey, the easier, the better for people, it seems.
Absolutely.
So, well, Dr. Lopez, I appreciate you coming on the show. Is there anything else that you would want to share with anybody listening?
No, I think that's it. We would love to have you. We are accepting new patients, so just contact us.
That sounds great. Well, thank you so much, Dr. Lopez.
Thank you. Thank you so much.